Okay, you can go ahead there, Dr. Fitzgerald.
Thanks. Good afternoon, everyone, and thanks for joining us today. Since the media advisory, or the last media advisory, we have 8 new confirmed cases of COVID-19 in our province. All are contacts of cases. 5 are in Eastern Health, 3 are under the age of 20, and 2 are between 20 and 39. There are 3 cases in Central Health, 1 between 20 and 39 years of age, 1 between 50 and 59 years of age, and 1 over 70. There have been 10 new recoveries, 6 in Eastern Health and 4 in Central Health, leaving us with 99 active cases in the province. The total number of cases for our province is now 1,992, so 1,992. 1 person is hospitalized as a result of COVID-19. 805 tests were completed yesterday for a total of 334,272 tests completed to date. As you are aware, we are currently experiencing a COVID outbreak on the Burin Peninsula. And the majority of these cases are in children under the age of 12 who are not yet eligible for vaccination. So until now, the evidence indicated that COVID-19 cases in schools were more often the result of transmission that occurred in the community, but this is changing. And Eastern Health's investigation into the current outbreak revealed the spread of COVID-19 occurred in the school throughout grades K to 6. Several other Canadian jurisdictions are also reporting outbreaks in schools, as well as a rising proportion of COVID-19 cases in children under the age of 12. And this is due to the more contagious Delta variant. Our most recent outbreak resulted in 2 schools moving to online learning, and public health strives to have schools open to in-person learning to the greatest extent possible for the health and well-being of children. So to help keep schools open, we need to enhance public health measures to reduce the risk of COVID-19 transmission. So effective Monday, November 1st, we're making 2 changes. First, we are extending the special measures orders for masking to include students in kindergarten to grade 3 and staff in regulated childcare centres. This means that masks will be required at all times indoors, including when children are seated in their classrooms. And we do recognize that some younger children may have difficulty wearing a mask appropriately for a longer period of time, but every little bit of extra protection helps. Second, after consultations with the Department of Education and school districts, cohorting will once again be required indoors and to the greatest extent possible outdoors for regulated childcare centres and grades K to 6 in schools. Limiting the interaction between classes will reduce the spread of COVID-19 in the event that it makes its way into a school or daycare. We are not recommending any changes for grade 7 and above, as a very good proportion of that population is fully vaccinated. And at this time, there's no indication of increased COVID-19 spread in those grades through school activities. I know that there are many worried parents on the Burin Peninsula right now, and I certainly understand your concerns. But we are more than a week into this outbreak, and Eastern Health has a good handle on the situation. And I want to assure you that if your child's school is open for in-person learning, that means public health considers it safe for them to attend. These additional public health measures are not forever. They are temporary until school-aged children have the opportunity to be fully vaccinated. We are hopeful that Health Canada will soon grant approval of the Pfizer vaccine for children aged 5 to 11. And once approved, we will be rolling out our immunization program for this age group, which is about 35,000 children in our province. Until then, we need to ensure a balanced approach that reduces the risk of COVID-19 transmission for the well-being of children. As the Halloween weekend kicks off, we ask everyone to keep safety in mind. So when handing out treats, please wash or sanitize your hands and wear a non-medical mask when answering the door. Drop treats into children's bags to avoid multiple children putting their hands in a common container. If you are unwell or self-isolating for any reason, please do not give out treats. Children should also stay at home if they feel unwell or are self-isolating for any reason. Be respectful of households that are not handing out treats and skip any home that has a sign on the door saying that they're unable to participate in Halloween. Remind children to wash their hands before they leave to trick or treat and when they return home before eating any treats. Parents should also remind children to physically distance as much as possible when getting treats at each home. Road safety is also important, so children should wear reflective materials, watch for traffic, and use crosswalks. If you are driving Halloween night, please be on the lookout for children and drive with extra caution. I also want to thank communities on the Burin Peninsula that have postponed Halloween until all children in the area are able to participate. This is a wonderful act of kindness and community spirit, and makes me once again proud to say I'm from this spectacular province. So have a safe and fun Halloween weekend, and hold fast, Newfoundland and Labrador. And I'll turn it back to you, Leslie.
Thank you, Dr. Fitzgerald. We have 5 media registered for today's availability. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
Dr. Fitzgerald, what's your advice for some of the younger children who may struggle with wearing a mask for long periods of time and may struggle to also just, not lose a mask at recess and things like that? That's been one of the main reasons that's held you back from making the mandatory masking order for younger grades.
Yeah, and I think, we need to be cognizant of that, and that it may take a little bit of time for all children to get used to wearing a mask for a longer period of time. I think most are comfortable now, and that when they go into a store or anything like that, they will have to wear a mask. And on the buses, of course. So the concept of wearing a mask for a period of time is not unfamiliar to that age group, but it is sometimes a little bit difficult. So I think it's important for parents to encourage children to try to keep it on, perhaps practice at home, just keeping it on for longer periods of time. Certainly it is something that I think as children get more used to the idea, it becomes more second nature to them. So it may take a little bit of an adjustment period, but I think we have to be cognizant of that and appreciate that period of adjustment.
We saw NACI has come out with more guidelines for who should get a 3rd shot, including anyone over 80, Indigenous communities, healthcare workers who may have gotten a very tight interval doses early on. Is Newfoundland and Labrador going to be following that guideline, and when do you expect that to start happening?
Yeah, so we certainly are, we want to be in keeping with what NACI has recommended. What we have to remember is that some of these recommendations are strong recommendations, some are discretionary. And so, it will require a little bit of, strategizing to make sure we do this as efficiently as possible. Some of it is already happening. We have started giving booster doses to people who are in long-term care. And so that's happening already. But over the coming weeks, certainly we will have more information on that and how we will be rolling that out.
Our next questions are from Noah Shepherd with VOCM. Please go ahead.
Hi, I was wondering with these new regulations, what are going to be the guidelines for school sports?
In the sense of wearing masks, or
are there any additional restrictions, or how's that going to work?
Okay, so those questions are being discussed at the moment, and certainly once we've come down on a decision about that, we'll be letting people know.
And I know you've briefly addressed this before, but is there any update on the use of rapid testing for schools in light of this these recent findings?
Yeah, so certainly it's something we are looking into, I think we would like to move in that direction at this point, but we're still trying to work through the logistics of that and exactly how we would do that. Obviously, that's going to take a little bit of consultation with our, with schools, school districts, and RHAs, just to make sure that we're doing it properly. So those conversations are happening, and once we have more information, certainly we'll be coming out with that information.
Thank you.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Hi, thank you, Dr. Fitzgerald. My first question is, what's your message to parents of students in schools where COVID has been identified and maybe they're just worried right now because the school is open and not closed?
Yeah, so what we have to remember is that when we close the school, public health takes that very seriously. It's not a quick or easy decision. It's not a reactive decision. We want to make sure that what we're doing is what's in the best interest for the health and overall well-being of the children. And obviously, if we look at a situation like in Sacred Heart, where we had a lot of cases in many grades, there was clearly transmission within the school community. And so that made the decision to go to online learning. There may be situations where we have a lot of contacts in multiple grades, and that may influence the decision to go to online learning. Just because there's a case in the school, it does not mean that that child got the case in the school. And it does not mean that that child spread the case in the school, because the child has to be in school during the infectious period as well. So we have to remember those things. So public health takes all of that into consideration when making a recommendation about whether a cohort should be kept out of school or whether a school should move to online learning. So if public health looks at all of that information and deems that the risk of spread is low within a school community, then they won't recommend to go to online. And we take that very seriously. And if public health is making the recommendation that in-person learning can happen, then it's safe to do so.
Thank you. And I know you mentioned this earlier, but is there any recommendations on trick-or-treating throughout the entirety of the Burin Peninsula? Should it happen at all in that area?
So I think it certainly can happen safely. And we've had, there's the cases right now appear to be fairly concentrated in that area, the greater Mayorstown Burin area. I think things can happen safely. So we're not making that, any recommendations with regard to not trick-or-treating in the areas. I think, given that so many children weren't able to trick-or-treat because you had so many in quarantine, I think communities themselves made that very kind choice to delay it. And I think that's wonderful. But with regard to those communities that are outside of the level 3 alert, I think it's, as long as the rules are followed, the general rules for COVID safety are followed, it can be done safely.
Thank you.
Our next questions are from Glenn Whiffen with the Telegram. Please go ahead.
Hello, Dr. Fitzgerald. Forgive me if I missed it, but this mask order being extended, is that just a Burin Peninsula or is that for the entire province?
No, it will be for the whole province. We're trying to reduce the risk in this age group across the board. And, just based on what we're seeing elsewhere, the amount of transmission that we're seeing in schools, we feel this is, just another extra layer of protection that we can add to reduce that risk.
Thank you. If Health Canada, or when they approves, or if they soon approve the vaccination for 11-year-old kids and under, how soon will those vaccines be able to be rolled out?
So we've been advised that we will likely have those very quickly after the approval comes through. Can't give you a definite date on that, of course, but we don't anticipate there will be a long wait to get the vaccine.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hi, my first question is, bringing these rules today, do you think that the outbreak on the Burin Peninsula wouldn't have been so severe if these measures had been in place?
So it's certainly, we know that masking can reduce the risk of spread, and cohorting can reduce the risk. And I think we may not have seen quite as many cases. It's difficult to say with hindsight, of course, but I think going forward, we have to do what we can. We take the lessons we learn, and we make the best decisions that we can with the evidence we have.
Thank you. And my second question, just related to gym class, music class, how will this apply? I want to make sure I understand what this means for those parts of school.
So masks will be required to be worn as per the masking SMO. So when people are involved in moderate activity, that requirement is not there any longer. So that would apply to gym class as well, but we would expect in music classes that the masks would stay on. And then if you're thinking band as opposed to choir or something like that, then we would, with appropriate spacing, you can still play the instruments without the mask on.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
Dr. Fitzgerald, what's your takeaway from the fact that we have seen a large number of cases in these young unvaccinated children, but we haven't seen a lot of spread to households and to the broader community on the Burin Peninsula?
So I think it speaks to the importance of vaccination, really, doesn't it? I think, given the contagiousness of the Delta variant, if we had seen this, if we were where we were in February, for example, with vaccination rates, I think we would have seen much more spread in that area. The fact that we're not seeing that kind of spread in the community is wonderful, and I think vaccinations are playing a huge role in that. I also think that, public health was able to act on this very quickly, and we were able to put those extra measures in place to reduce people's contacts, and that certainly has helped subsequently, but certainly the vaccination has helped immensely.
Noah Shepherd with VOCM, do you have a final question?
I do. Residents in the Marystown area have been expressing a bit of concern with the frequency of public updates. I know the MHA brought it to the House yesterday. Is public health considering any form of daily updates, whether it be for the greater public or just for the Marystown area?
So at the moment, we're giving updates, Monday, Wednesday, Friday with our releases, with regard to case numbers and things like that. I think the people in the area, the leaders of the communities in the area, are being updated quite well by Eastern Health as to the status of the investigation and what's happening in the community. So I do feel like, there's a lot of engagement there. So right now, things will remain as they are.
Thank you.
Ben Cleary with NTV, do you have a final question?
Yes, I do. Thank you. Will any additional resources in terms of testing or anything else be sent out to the area of the outbreak?
So they've already had quite an increase in their testing out there. And so Eastern Health has a mobile team for testing that will go to areas of outbreak, and that team has been deployed there. And so they've actually had quite a bit of extra support for their testing.
Glenn Whiffen with the Telegram, do you have a final question?
Yes, quick question. So masks, just to clarify this for me again. So masks for these kids will have to be worn when they arrive at school and during class, in class as well?
Yes, so the mask, well, if they take the bus, it'll have to be worn on the bus, and then it will be expected to be worn at all places in school, unless they're eating or drinking. And then if they're participating in activities that they're not able to wear the mask, for example, playing a musical instrument or a woodwind of some type, or in engaging in moderate activity, then those would be the exceptions. But other than that, they would be required to wear their mask.
Thank you.
Patrick Butler with Radio Canada, do you have a final question?
Yeah, one more. Just about the outbreak on the Burin Peninsula. Can you give an update about how many cases are actually related to that outbreak? And if you're able, how many of those are people under 20 years old?
So I actually don't have that information in front of me right now, Patrick, and I don't want to give you the wrong information. It's kind of changing by the day, of course. But we can get that information for you.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks everybody for joining us. And, we've seen down on the Burin Peninsula the importance of vaccination and what it can do to help reduce the spread of an outbreak. So please get your vaccine. If you haven't gotten your first shot, book an appointment to do so. And if you haven't gotten your second, if it's been more than 4 weeks since your first, you can certainly book to get that as well. Really important. I hope everybody has a safe and happy Halloween. Take care.
Thank you, Dr. Fitzgerald. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.